Hello and welcome to today's webinar, Quality Decoded, CMS Advance Notice. I'm Cassie Yazzo, Senior Product Marketing Director here at Cotiviti. Thank you so much for joining us today. Marge Ciancetta is a Product Manager for Cotiviti's Quality and Stars portfolio focused on our Star Intelligence solution, which assists health plans to track, predict, and model CMS star ratings. Marge ensures that Star Intelligence represents the voice of Cotiviti's customers and aligns with industry best practices. With over a decade of experience in quality and Medicare Advantage star ratings, Marge has a unique perspective on the challenges and opportunities facing health plans and providers today. She works closely with our development team, as well as with customers and stakeholders to ensure that their feedback is incorporated into the product roadmap. Today, during the first webinar of Cotiviti's year-long Quality Decoded webinar series, Marge will decode the 2025 CMS Advance Notice, the annual guide to methodological changes shaping Medicare Advantage and Part D star ratings. She will analyze proposed changes, provide insights on crafting impactful comments to CMS, and together we will learn about how policy adjustments may impact star ratings in 2025 and beyond. Without further ado, let's turn it over to Marge.
Thank you, Cassie, and thank you everyone for joining us today. My name is Marge Ciancetta again, and I'm very excited to be talking with you. As Cassie said, we have a lot of information to cover, so I'm going to jump right in. Every year, CMS publishes the Advanced Notice of Methodological Changes for Medicare Advantage, capitation rates, and Part C and D payment policies, also known as the Advance Notice. It's an announcement of all of the routine technical updates, improvements, recalibrations, and plan changes to methodology used to rate and reimburse Medicare Advantage programs for the upcoming year and beyond. In other words, CMS shares all of the upcoming changes planned for the MA program. CMS is required by law to share these updates with the public before anything is written into law. This gives plans and the public 30 days to review, digest, and comment on any issues or concerns identified in the advance notice before it's codified in the final rule. This year, the advance notice was announced on January 31st. Comments on the advance notice will be accepted through March 1st. And then CMS has 30 days to review all of the comments and finalize their changes before the final rate announcement is published on April 1st. So right now we're here at step number 2, the public comment period. And that's why we're gathered here today, to review all of the upcoming changes, talk through what impacts they might have on your plan, and help inform your comments back to CMS on the advance notice. The advance notice is huge. It's 186 pages this year and contains far more information than we can cover today. It's a compilation of 7 different attachments, and we'll be focusing on attachment 4 today, which covers the updates for Part C and D ratings. We'll cover reminders, measure updates, changes to existing measures, retirements, display measures, and potential new measure concepts. As we go through this presentation, I encourage you to jot down all of the items that you feel would have the biggest impact on your plan. This is your chance to make sure your voice is heard and influence regulations proposed and codified by CMS. And when we reach the end of the presentation, I'll share with you the actual process for reaching out to CMS to voice your opinions. Okay, without further ado, let's start off with measurement year 2023, also known as star rating year 2025. This would be dates of service from January 1st to December 31st of 2023, with that final submission to NCQA and CMS due at the beginning of June. With 2023 mostly in the books, there's really not too much left up in the air. As a reminder, the changes listed here have already been codified by CMS. They include PCR increase from a 1x to a 3x weight. Breast cancer screening must now be reported as an ECDS measure. CBP, COL, and KED had previous optional exclusions that are now required. The Getting Appointments and Care Quickly measure previously had a question about 15-minute wait times, and that was removed. And there were changes to the advanced illness and frailty value sets, and now more than one code is required to qualify for those exclusions. And finally, the web survey mode was added to the CAHPS measure surveys. There was just one update for measurement year 2023. These two measures for substance use disorder and opioid prescribing were submitted to the measures under consideration list for 2023, which allows CMS to consider adopting these measures through future rulemaking. In other words, they plan to add these measures to the star ratings program at a later time. 23 was nice and short and sweet. Now let's move on to measurement year 24, also known as star rating year 26. This would be dates of service from 1/1 through to 12/31 of 2024, referring to the prospective measurement year that just started. Even for MY 2024, most of the changes are already codified and in the books. Any proposed changes for MY 24 are likely to be non-substantive or changes that you'll see bubble up through the display measures page. So let's start with a quick recap of the previously codified changes. First, the patient experience and complaints and access measures were reduced from a 4x to a 2x weight. We see the improving and maintaining mental and physical health measures returning at a 1x weight. The kidney health evaluation measure is now part of the star ratings program at a 1x. Colorectal cancer screening must now be reported as an ECDS measure. The BCSE measure was updated to include transgender and gender diverse members in the denominator. The med adherence and SUPD measures now align with PQA's continuous enrollment criteria. And finally, the SUPD measure now aligns with PQA's age criteria. Age is now determined as of the first day of the measurement year. Now, let's move on to the proposed changes. First up, CMS is making two changes to members choosing to leave the plan to more accurately identify disenrollments. They're planning to update the methodology used to identify moves out of the contract area, and they plan to exclude enrollments into an applicable integrated plan. Both of these are non-substantive updates that would be implemented beginning in star ratings year 2026. Next is a change to the breast cancer screening measure. NCQA is considering expanding the age criteria for breast cancer screening to ages 40 through 74, which is a substantive measure change. I'm going to struggle saying substantive all day, so I apologize. If this change is made, then the updated measure with the expanded age criteria would be on the display measure page for 2 or more years, and the legacy measure would remain a part of the star ratings program until the new measure can be promoted. CMS is proposing a non-substantive change to the Part D measures that are listed here. There's several of them up at the top. CMS proposes switching from the enrollment database to the common Medicare environment to identify hospice stays and ESRD status. The purpose of this change is to improve data availability, so to make sure that we're finding all of the ESRD and hospice exclusions, though no major impacts are expected. This is a non-substantive change that would take effect in MY24. Now let's talk about the display measure changes for MY24. While these aren't a part of the official star ratings program, this is where all the substantive measure changes get their start. So it's a good idea to keep an eye on the display measure changes to get a flavor of where CMS is heading and what to expect in the star ratings program in future years. In order to round out CMS's universal foundation, CMS will be adding the DSF and AIS measures to the 2026 display page, which is the first step in making these measures a part of the star ratings program in future rulings. PQA is making some updates to the polypharmacy measure for anticholinergic medications. 14 medications will be removed from the measure due to low usage and/or unavailability in the US. This is also a non-substantive change that would take effect in MY24. CMS is following suit with PQA's proposed changes to the two polypharmacy measures listed here. Per PQA's measure manual, the index prescription start date will be removed from these measures because it wasn't really capturing the intent of the measure. Instead, the measure will look for 2 or more fills of the same target medication on 2 different dates of service, and then make sure that the earliest service date is at least 30 days from the end of the measurement year. So just a small change. that is expected not to impact the measure, and it will be updated in MY24. Okay, CMS will also be aligning to PQA's changes to the Part D display measures listed here. The concept of an anchor date will be removed for these measures, and instead, members will be required to meet the continuous enrollment criteria. I'm also very happy to say that CMS will be eliminating the measure year adjustments for these measures. So we're finally seeing that alignment with PQA, and there will be no ambiguity between the different measure sets. So these changes are expected to take effect in measurement year 24. There's a whole slew of Part D measures listed here, and CMS proposes switching from the enrollment database to the common Medicare environment to identify hospice days and ESRD. So the same measure changes that we talked about earlier are going to be made to these display measures as well. And again, the purpose of this change is to improve data availability, though no major impacts are expected. And finally, the last plan change for MY24 is with the AMM measure. This measure is currently on the display page, but will be removed starting with MY24 because NCQA intends to retire this measure. Okay, I'm going to pause for a moment here and catch my breath. We will finish out MY24 and jump into MY25 in just a second. And as I mentioned, there are quite a few changes being proposed, and it can be hard to keep track of everything. So if you find it helpful, I encourage you to download Cotiviti's CMS star ratings calendar, which captures all of these changes that we're discussing here today. It's available via the QR code on the right side of the screen and can be a handy reference as you create your public comments back to CMS. Okay, let's move into measurement year 25, also known as star rating year 27. As we move further out in time, less is known and codified for sure, and more remains up in the air. There's just a few codified changes for measurement year 25 that we already know about. One is improving and maintaining mental and physical health. They will both move to a 3x weight. And additionally, the health equity index will replace the current reward factor adjustment and be based on data for star rating years 2026 and 2027. Now let's move to the proposed changes. Again, we'll start with the changes to the star ratings program, then move on to the display measure changes. First up for measurement year 2025 is diabetes care eye exam. NCQA received feedback on this measure that it would be helpful and useful to have more specific numerator codes, especially as NCQA intends to move to digital measurements. Adding those additional numerator codes would be considered a non-substantive change and could be included for measurement year 2025. NCQA also received feedback on the need for an exclusion of members with statin intolerance from the SPC measure. NCQA plans to add the exclusion myalgia or rhabdomyolysis caused by a statin via a new value set. CMS considers this to be a non-substantive change, which could be implemented for measurement year 2025. Okay, CMS is also announcing the removal of the Care for Older Adults Pain Assessment measure. When NCQA retires it, CMS will retire it as well. NCQA plans to replace this measure with a more comprehensive chronic pain assessment and follow-up measure, which I'll detail in just a moment. At the earliest, this measure will be retired in measurement year 2025, but this change is dependent on NCQA. Now let's move into the proposed changes to the display measures for 2025. PQA is testing an exclusion to the following Part D pharmacy measures listed here. Beneficiaries with cancer-related pain treatment could be excluded from these opioid-related measures starting in measurement year 25 at the earliest, as CMS follows PQA's lead on those. NCQA is planning an overhaul to the follow-up after hospitalization for mental illness measure. They're considering an expansion of the measure's population and options for follow-up as described below. The goal of this the goal is to make the measure more comprehensive and inclusive of more hospitalizations and more treatments. CMS is expected to follow suit on any changes that NCQA makes starting in MY25. One interesting note here from the advance notice was that it says NCQA is reevaluating this measure for continued relevance and validity. So in other words, they may consider retiring this measurement in the future. I'll pause here for just a second so you can look through these changes. Okay. Next, for measurement year 2025, CMS is proposing the inclusion of another universal foundation measure, social needs screening and intervention. Since this is a new measure to the STAR ratings program, it will need to stay on the display page for 2 years before it can become part of the STAR ratings program. Note that NCQA is exploring the addition of a utilities insecurity screening and intervention indicator on the measure. So the measure specifications for this measure may continue to evolve, but since this is part of the universal foundation, it's quite likely that this measure will move to the official STAR ratings program once those measure specifications are stabilized. CMS plans to make some small tweaks to the adult immunization status measure in 2025. Following suit with NCQA, there's going to be 3 changes. One, the age range for the pneumococcal indicator denominator will drop from 66 to 65. The option to receive a herpes zoster live vaccine will be removed, and a new indicator to assess hepatitis B vaccinations will be introduced. Similar to what we've heard with other PQA measures, CMS will align with the PQA measure specifications for the measures listed here. Specifically, they will now use continuous enrollment and no longer adjust for member years. I, for one, am a big fan of the measure simplifications and streamlinings that they're proposing here. So I'm so glad to see that they're making these changes for alignment. Next up is the OMP measure. If PQA retires the OMP measure, then CMS will follow suit and retire the OMP measure as well. This measure is currently on the display page, but it could be removed starting in MY 2025, depending on what PQA decides. CMS has also outlined 4 potential new measures for 2025, which we'll go through now. These are net new measures that are not currently part of CMS, NCQA, PQA, or any other steward. So the first measure is that NCQA is exploring the development of a new blood pressure control ECDS measure. The new measure will include 2 numerators, one for the current 140/90 measurement and a new measurement for the lower 130/80 threshold. Members could qualify via claims-based diagnoses or by a dispensed antihypertensive medication. CMS can consider adding this to the STAR ratings program as a replacement for the existing controlling blood pressure measure. So similarly to what we said for BCS, the new measure will need to stay on the display measure page for at least 2 years, and during that time, the existing CBP measure will remain in the STAR ratings program. Okay, NCQA is exploring the development of a new measure to assess documentation and follow-up of abnormal mammogram results. The measure would contain 2 rates, one for documented breast imaging assessment and one for the follow-up after an abnormal screening. This measure is proposed for MY 2025, but that's dependent on NCQA. The third new measure CMS proposes for MY 2025 is the social connection screening and intervention measure. This would be an ECDS measure developed by NCQA to measure screening for social isolation, loneliness, or inadequate social support, and a corresponding intervention following a positive screening. And finally, for MY 2025, CMS is considering the addition of NCQA's new ECDS measure, chronic pain assessment and follow-up. So this measure is intended to replace the existing COA pain assessment indicator, which is planned for retirement. As I mentioned earlier, this new measure is more comprehensive than its predecessor. It includes all Medicare members and also includes both a multi-dimensional screening and a follow-up. Okay, so we made it through all the MY 2025 changes. Let's all take a deep breath, grab a drink of water. I wasn't joking when I said there was going to be a lot of changes. Again, I welcome you to download the calendar so that you can keep track of all of these changes. And I really encourage you to hang in there as we make our way through the changes in MY 26 and beyond. Even though these changes are less certain and they would be implemented further out, it's a great way to understand where CMS is headed. What are they thinking about? What are they focusing on? Understanding these proposed changes can help you inform your plan's long-term strategy. All right, MY 26, also known as Star Year 2028 and beyond. So there aren't too many codified changes to remind you of for MY 2026. One thing that we do know is that CMS plans to update the med-adherence measures. First, they plan to risk adjust these measures for socio-demographic status characteristics. And next, they plan to remove the inpatient and SNF stay adjustments to align with PQA, again, promoting that consistent measurement across programs. Now, let's move on to the proposed changes. Similar to past sections, we'll focus on the proposed changes to existing measures first, and then move on to those new measures and concepts. Out of respect for your time, I'm not going to go into too much detail on these. If you do need additional detail about these proposals, I encourage you to review the advance notice to obtain all of those details. So first up, for MY 26, there's two substantive changes to the appeals measure, one to eliminate that 5-day grace period, and another one to use the electronic system receipt date. In other words, even if an appeal is received after business hours, they will use that date as the appeal date. Both of these would be part of a new measure that would have to be on the display page for 2 years, and the legacy measures will be retired if and when new measures are promoted. NCQA is looking to make some cross-cutting changes to how it identifies members with chronic conditions. These measures will aid NCQA's transition to digital measurement. In addition to the claims and medications used to identify members today, NCQA wants to include clinical data, such as an active diagnosis on the problem list, to identify those chronic conditions. So CMS will provide more information as NCQA continues to explore these potential updates. NCQA wants to continue its work on removing gender language from measure specifications. So the 2-star rating measures that are under consideration for these changes would be statin therapy and osteoporosis treatment, and CMS will continue to provide more information as NCQA continues to explore these changes. Okay, CMS is considering some updates to the 6-question composite survey for care coordination. They're going to remove 2 questions and add 2 new ones with the hopes of putting more emphasis on test results. The changes to the questions are listed here for your reference and also available in the advance notice. If implemented, these would be considered substantive changes. NCQA is exploring the development of a new ECDS measure to assess follow-up after a functional status assessment. Other than the general measure concept, they gave very little information about what was provided or intended for this measure, but they did mention that any potential new measure is currently planned for measurement year 2026 at the earliest. NCQA is exploring the development of 2 new ECDS measures for tobacco screening and lung cancer screening. Again, they would be brought into CMS star ratings through future rulemaking. CMS is looking to enhance the health outcome survey. Again, this was a very generalized announcement where they outlined some potential new survey items, but didn't really give a lot of detail. It's just any new changes would go through the measures under consideration process before being added to star ratings. And finally, my last update. CMS wants to make updates to the MPF drug pricing measure based on the proposal. It sounds like they're still heavily in the measure design phase, and they're seeking some initial concept on the general measure concept. So CMS is concerned that some plans might be submitting artificially high or low prices on the Medicare Plan Finder tool during open enrollment to encourage or discourage current beneficiaries from selecting their plan. So they're looking for a better way to monitor measure pricing throughout the year. All right, one last time. If you need the link to the calendar, there it is. And if you need help building your strategy, Cotiviti tracks and applies CMS's updates and measure weights in our Star Intelligence solution, helping our clients get ahead of anticipated changes. To learn more about Star Intelligence, please contact us at answers@cotiviti.com.